HIV these days is usually well controlled with highly active antiretroviral agents, but in patients in whom treatment has not worked or has not been commenced, you can get the HIV retinitis, characterized by the red and white patches in the retina, and it tends to carry a poor prognosis both for vision and for life because the CD4 count tends to be very low. Glaucoma is now an optic nerve disease, and we're going right to the back of the eye now, behind the retina. And the point to be made about glaucoma is that having seen my glaucoma masterclass, you will know that it is an optic neuropathy. It is often associated with raised intraocular pressure, but not exclusively, but always produces the characteristic pattern of arcuate field loss and the hollowing out of the optic disc. It tends to be more prevalent in the elderly and is the third commonest cause of blindness in the UK. But if you detect it early, these patients do not go blind and do not even lose their driving license. We diagnose it by testing the pressure of the eye, recording the field of vision of the eye, and looking at the optic disc. And so here's an example of an optic disc where the optic disc size is there, but the cup of the optic disc is very small there. So that is a normal functioning optic nerve with all this representing the retinal ganglion cells which are functioning. As the glaucoma progresses, so the size of this cup gets bigger and bigger and bigger as the rim of the optic nerve disappears, until there's almost no rim left for the patient to see with, and they lose all their peripheral and eventually central vision and become irreversibly blind. Most causes of glaucoma are caused by blockage of outflow of fluid in the trabecular meshwork between the iris and the cornea. You should look at this in more detail by looking at the glaucoma masterclass on YouTube. Treatment for glaucoma is with lowering the intraocular pressure, both by eye drops and by surgery, which can be by laser or incisional surgery. The surgery aims to create an extra drainage channel, and when performed in good hands is very effective, but there are lots of risks associated with it which need to be managed subsequently. Another optic nerve disease is ischemic optic neuropathy. And here you need to be very aware of giant cell arteritis, because giant cell arteritis causes causes arteritic anterior ischemic optic neuropathy, which can cause irreversible blindness in both eyes, one followed by the other. So it's important to take a history of polymyalgia and of temporal arteritis, and where necessary, commence high-dose steroids whilst waiting for the results of further tests. By contrast, non-arteritic anterior ischemic optic neuropathy presents in very much the same way, with sudden loss of vision of one eye, but is due to embolism. Optic neuritis is an inflammation of the optic nerve, and in the vulnerable age groups is often due to demyelination and is loosely associated with multiple sclerosis. It's important to remember that it is not exclusively caused by multiple sclerosis, and patients presenting with optic neuritis should not be allowed to labour under the misapprehension that they have definite MS. Optic nerves can be damaged by excessive alcohol intake and malnutrition, the so-called toxic optic neuropathies, as well as by drugs that we can give patients, such as ethambutol, as part of a 6 or 12-month treatment for tuberculosis. Optic nerves can be infiltrated by disease processes such as cancer and amyloidosis, and we need to consider this when we're thinking about optic nerve disease. Finally, of course, brain tumours can push on optic nerves and cause visual impairment. This can be a meningioma of the optic nerve, or a pituitary tumour sitting over the optic chiasm, taking signal from both optic nerves at once. Severe head trauma can cause optic nerve stretching or even transection. This tends to be with road traffic accidents, but also with severe assaults. I'm briefly going to talk about amblyopia in the setting of eye diseases. Amblyopia is also called a lazy eye and is a visual impairment due to the failure to develop normal vision in infancy in an otherwise structurally normal eye. It can be caused by a squint, whereby the child just ignores the second image from the deviating eye. It can be caused by refractive error, whereby the blurred vision of one eye is not corrected by glasses early enough in childhood. It can be caused by the signal not getting to the optic nerve in good condition, for instance due to congenital cataract. The treatment for amblyopia needs to be commenced and completed in early childhood, and we use the 3 O's here. Sometimes glasses are all you need to treat a squint and the subsequent amblyopia caused by that squint. Sometimes we need to patch the good eye in order to encourage visual development in the lazy eye, which can then make a good neurological connection with the brain. Finally, we can do eye muscle surgery just to realign the eye in order to help both eyes work together and develop good vision together. If a patient presents with double vision, this is really neurological disease rather than eye disease, but as eye doctors we recognise the cranial neuropathies, which are of course the 3rd, 4th and 6th cranial nerves, and I'll leave that up to you to revise the functions of these cranial nerves and also the symptoms when these cranial nerves are damaged or malfunctioning. So to summarise visual impairing diseases, it's important to remember that blindness in modern westernized countries is rare. Only about 2 in 1,000 people in this country have visual impairment, mainly due to macular degeneration, but also due to glaucoma and diabetes. In the developing world, almost 1.5% of the population can be considered blind, and the main cause is cataract, but also trachoma and glaucoma are significant contributing diseases to this burden of blindness. So to summarise what we've talked about in this talk, you can get poor vision due to refractive error, which is poor focusing, to media opacities from cornea, from the lens, from the vitreous, or you can have problems of phototransduction in the retina and the optic nerve, but also problems in the brain caused by, for instance, brain tumours or strokes. Amblyopia is a specific form of vision impairment acquired in early childhood and cannot be fixed in later life. Thank you very much for your attention.